fellow viewers and listeners, my name is Joy Kulola from Vision Changers Kenya. We are happy to have you join us today for this conversation at our podcast at Vision Changers Kenya. This is our second episode of the year 2025, and with me today are amazing people that are joining us for this conversation, and I would like them to introduce themselves and tell us what they do, and then we can continue the conversation. Thank you. Welcome.
Hi Joy, hi viewers. My name is Wanja Maina. In the mtaani, I hear some people calling me Hummingbird. I'm the founder of an organization called the Hummingbird Grassroots Center. It's a grassroots young women-led organization huwa tunafanya a few community projects around health, climate, na issues of the right to food, and I look forward to the conversation.
Thank you.
Hello Joy, my name is Arthur Kalyan. I work in the Nairobi City County, Department of Health. By profession, I'm a public health officer based in Kariobangi, attached to Kariobangi Health Center, and I also coordinate water, sanitation and hygiene within Embakasi North Sub-County.
So our topic today is service delivery. We are specifically focusing on health, and we have amazing people, as you've heard them introduce themselves. There are people with good knowledge and rather experience in matters health across the country, who will also be sharing their insights about the topic we're just about to discuss. So I'll like to start with Wanja. I think in the course of this week, or probably last week, there was an incident where a lady showed up at the Ministry of Health offices talking about SHA and complaining how it's not functioning and how the systems were down and all these kind of things. As a lady, what crossed your mind in terms of service delivery in Kenya, and specifically you as a woman and a sister, a mother, a lady in general? What are some of the things you think are going wrong, or rather, what is your take pertaining service delivery?
Thanks so much, Joy. As a lady, as a mother, okay, I'm not a mother, as a sister, as a Kenyan, even as a human being. Kusema tu kweli, first I was very proud of that lady. You could tell women empowerment. You could get this a person who is not afraid to speak the truth to power, because I believe she found some senior government officials in a boardroom. I think the first thing that go to my mind ni most of the policies that are made in the high government offices vis-a-vis the practicality of those policies. Because if those government officers venye walipata kwa hiyo boardroom na mama akilia, and we thank God the media was also there, then that was enough testament that ni kama hiyo project wenye wanafanya haiwork. You know Joy, this issue of health, kama mama hakuwa, the mama who was talking, yes yo mgonjwa, lakini akona patient. What people really don't understand ni ati kwenu kukuwa na mtu mgonjwa, kama ni mtu mmoja, ni kama watu wote kwa hiyo household wanane ni wagonjwa. Oh, vibaya sana juu unapatanga, like for example, not too long time ago, one of my parents was unwell. Kuna ile coordination ya ni nani ataenda asubuhi, ni nani atarudi, uji daktari alisema nini. So all of you end up being trapped in a whole health system. So it does not necessarily affect ule mgonjwa. In fact, ule mgonjwa hata hawezi kujitetea. By the time, you know, you are somewhere bedridden, you are the mercy of all others. Lakini kusema tu kweli, history ya health, shisha, hiyo transition, from the very onset, inakaa so haphazard. Because nakumbukanga, before ianze, I think July, ile mwaka ilipitanga, I remember there were over 5 cases around it. Hadi union ya madaktari walikuwa na some issues with it. I even remember the judiciary wakitengeza a bench of judges kubishana, kusema hapa there are a lot of raffages. Some of us ask, if it's not broken, why fix it? Kama tulikuwa na NHIF yenye tulikuwa tumezoea, instead of reinvention, why can't you just improve what we already have? So mimi nimekuwa tu nikisikia most Kenyans wanaongea kuhusu some of those challenges that system as a whole. But also, you know, Joy, ukianza kuinteract na watu, people of low income needs household, unajua wale watu wananga pesa hata wainangi hospitali. Mtoto wake akikojeka usiku, wacha tulale tuone vile atamka asubuhi. So by the time someone has gone to hospital in this African setups, huyo ni mtu mgonjwa kabisa. Sababu in our country, like in the West, unasikianga mtu ni kama almost mazoea ati unaenda an annual body check up. Lakini Kenya ni ile siku uta faint ndio watu watajua uko na diabetes. Lakini kama inge detectiwa 5 years ago, haungeanza mambo ya insulin and what have you. So by the time your average Kenyan is in hospital, huyo ni mtu by many standards ni mgonjwa. Otherwise anambiango, tumwekele katabe leo mtoto aache kuwa moto because mama yake hana ile 500 ya kupeleka kwa clinic. So it's a big issue. It also speaks generally into how we are as a country. Yeah.
So you think service delivery already has an issue?
Iko too funny. You know, health in Kenya is a devolved function. Mimi kusema ukweli sijaisikia governor. Yule kama ni devolved function inamaanisha hiyo kitu iko square kwa mikono ya governor. Mimi najaribu kurecollect mind yangu vizuri ni picha ya governor fulani tu kuja kwa kichwa governor akitetea health, akitetea SHA, akituambia tu transition, nothing comes to mind. So unajiuliza hii SHA yenye inapangiwa Ministry of Health offices because mama Selina kuteta Ministry of Health. If health is a devolved function, huyo mama anafaa kujua pale anafaa kuteta akiwa Nairobi because it's devolved. It also speaks probably into the fact that national government ni kama ina impose hizi vitu na hata pengine kwa magavana wakiulizwa vizuri wanaweza sema hii kitu ni kama iko na ... So those are also the questions. How come it is mostly pushed by the national government if it's devolved? So for me nimekuwa tu nikisikia watu wakicomplain. But also in Kenya kitu moja nimekaa kujua which is unfortunate. Saa zile una benefit from a privilege wanange kani kitu mbaya. Even me naweza call out atika saa hizi tuseme nataka kitu in a certain government office. I could have some form of privilege that I have someone anawaka kwa hii government. Kwa hii government office. Lakini ule mtu mwenye ana mtu wa kupigia akiwa Kenyatta, and just the other day which was heartbreaking, a minister's son aliibiwa stroke abduction. Anasema ati nilienda nikaambia president mtoto wangu ameibiwa. So the question was ule mtu mwenye hizi access president. So the issue of she working, probably ule mtu akona insider wao ndani ya system anaweza facilitate ka system ka work. But for me, for this SHA to work, it must work for the mtu wa chini ati saini kiamka hivi kichwa inaniuma na izaenda Kenyatta bila kuwekwa lazima ati nikuwe najua mtu, lazima nikuwe na kapesa. So mi hiyo naonanga ikiwa unfair to the people wenye wana connections.
Okay, asante sana Wanja. Wacha niulize Arthur, what do you think is the current status of service delivery? You as a public health officer, relating to just the case that we've talked about, ule mama alienda kwa Ministry of Health aki-complain about SHA not working, systems being down and all that was happening. What do you think about the state of service delivery?
Actually, I think the state of service delivery is not that bad because we are transitioning from the NHIF to SHA, and you know that change is gradual. So you can't just wake up one day then the system starts operating 100%. There must be, most definitely there'll be hitches, technical hitches. Then again, when SHA was rolled, I must say that there was the community were not ready for SHA because the government didn't do a lot of sensitization. The community needs to be sensitive because even us, even in healthcare system, you'll find that some of us have not even registered on SHA, yet they're deducting salaries. So even healthcare workers, they really need to do a lot of sensitization to both healthcare workers as well as the community members. Then I must say the incident that happened, when was it? Was it this week? I must say that it was an unfortunate incident, and I believe we're very sorry as healthcare workers. I must say it was not good, and it shouldn't happen so. So maybe what I can advise the government, though already there's in the healthcare system, we have at the community level, we have people known as the community health promoters who are tasked by registering community members, onboarding community members into SHA. But you still find some people don't want to register. Then when you get sick, you go to the hospital. When you register the very day, you're not able to get the services because it will take you like around 5 to 6 days for you to start benefiting from SHA. So I think the lapse that is there, or rather the major challenge that is there, is that the government really needs to do a lot of sensitization in regards to SHA.
Okay, and as we continue talking about now SHA, I have heard you mention that some of the community members were not willing. So in terms of transition, can you say that there's been proper transition, or still the margins are way too low from now the community members?
I think there's still a lot of gaps, because the problem that we have with the community, like now most people are opposing the government, the national government, the government in place. So most people, then also there's this mentality that people think that corruption issues, blah, blah, because it had already been set, it is a precedent that was already set. So most people tend to think that when they register for SHA, the government is the one that is going to benefit. But I must say that in terms of service delivery, like right now, facilities, healthcare facilities are already getting money from SHA to ensure that they offer adequate and adequate services at the facility level so that the community members can benefit. I think the major challenge is registration for SHA, then the systems are also jammed. Yeah.
What is the issue around systems? I'm not an ICT expert, but I sort of feel like in as much as you're talking about change is not easy and all these kind of things, of course there will be mishaps here and there, but what is the period? Because now if SHA was to roll out, was it last year October?
Yeah, last October.
Up to date, we are how many months later? So November, December, Jan. Okay, 3 months still. So for how long are we still going to sit in these systems not working and all these kind of things? Yesterday, if I'm not wrong, I think KNH released a statement talking about systems being worked on, etc. Does that mean that up until someone raises a complaint, that is when people get to look into things? Because again, if the issue was not raised, if that mama didn't go to the Ministry of Health, will that system not still be functioning at this particular moment? Because again, there was no person to advocate for it, or rather there was no person to go out and talk about it in the public domain. While we understand, yes, issues will always be there, systems, the transitions, also the people who are dealing with the system to understand how it works, and you know, like now the medics, or rather the healthcare promoters, everyone involved in the sector to be made aware and things like that. Are there trainings to begin with? Were there trainings on the transition? Ama you guys just woke up and you're told SHA and then now you follow? How was it like?
Actually, there were trainings, and the trainings are still on healthcare workers. Yeah. They're done at the facility level. Yeah.
That's amazing to hear, because with that there's hope that the transition will continue to be effective. But I don't know, I don't understand this system issue. Maybe Wanja, could you be knowing anything about systems?
Okay, me Joy, I don't know about systems because that is just a name. What is in a name? During when I was younger, I'm not too old, I'm still, by government standards, I'm still a youth. Tunaulizangwa, youth inaishanga 34 or 35. By the way, speaking of youth, a friend tells me that youth inaisha 34. So Kenyans, I don't know who told them it's 35. Anyway, that's beside the point.
What if we could
Joy, what is in a name? Whether tutakuita SHA, whether tutakuita Taifa Care, NHIF, even by any other name, a rose is still a rose. Even ndio Shakespeare alisemanga, akisema like, tuache, we have an obsession with names. Lakini mimi najua ule mtu sahi amelala Kenyatta, ama Bagathi, au those government facilities. Yeye tu kitu yenye namsumbua ni venye anaweza pona aende home, na familia yake ni vile na feel iko trapped kumpelekea uji. So for me, I feel like this obsession with names, new names does not necessarily mean a new attitude to fix the healthcare system. Unajua sometimes mimi naonanga ka Kenya we also love to replicate vitu. Si kulikuwa na data ya NHIF. Si hao watu wenye walikuwa na to deal na sisi NHIF ni watu wa health. Si nilikuwa naitwa Hana Wanja hiyo time. Si sasa naitwa Hana Wanja. So waliandisha ID. Wana need kufanya nini na already wako na information yangu. Unajua even in Kenya sometimes how we handle data, naonanga ni kama like tuseme sasa tuko hapa. Mnasema register for this. Haya, kama uko na majina na information, already ukisha kuja uniambia, by the way, I'll also use your names to do this for another project. See, that's okay. Because even if we have to keep replicating, that is one of the things me wanna struggle sana in terms of health. But Joy, you know, the other day, I think I was even with one of these media stations, and I gave a very good, according to me, I think it's a very good example. Where I live, in one of these Nairobi places, being the millennial that I am, sometimes I don't like to cook. So there's a kabandaski I usually like to go to. Do you know why I go to that specific one or not any other? It is because the owner of the kabandaski, the lady, is usually there and she eats there. So knowing the hygiene issues in Nairobi, I'm like, if the owner is eating there, like she'll come talking to me, wanja, she's eating chapati, mandazi, you know, they always eating. So I think I am confident in terms of the quality of her vegetables and ugali because she's eating there. My biggest issue with some of these projects is that most of the people who implement them do not access services there. So this is a person, they're not the consumers. Let's look at senior government officials. The truth of the matter is that unless like under very unique circumstances, these individuals access health services in high-end private hospitals in Kenya. With high-end private hospitals in Kenya, because we know them and probably we have gone there from time to time, you have a personal relationship with the secretary of your doctor. So by the time nataka kwenda nanzanga kupigia nani, by the way nikam sangapi. So this is highly personalized private healthcare. But we are also talking about poor Kenyans wanamkanga 4 AM wapande mat ndio Kenyatta wasikuje kukua na line. Hizi vitu happen. Mama Lucy is not, we know it is a facility. People wake up early to go to hospital. Wasikute line. So for me, one of the things I've always struggled with the Kenya that we have is that most of the people who make policies for our children, hata JSS, the education system, hata CBC, do not consume those services. Joy, and I'm digressing, kuna mtu alikuwa anauliza aje. Sahi kuna primary school imejaa watoto wakienda class 9, grade 9. Lakini saizi juu mwaka watu wakwenda form 1, kuna classes za form 1 4 ziko empty. Ebu nieleze hiyo logic. Ati there is a primary school imejaa watoto juu watoto wa grade 8 walienda grade 9 in the same primary. Lakini kuna high school aina form 1 because kuna class empty because hakukuja watoto. Is that prudent use of resources? Surely
it is not.
It is not. And for me, I'm like, if we really want to put some form of decency, we have to start asking ourselves, how come people are curating projects and programs, na hizi health programs, yet they cannot consume? How bad is it that you are making these services for the poor, low income and poor people if you can't consume?
It's very good. The question you're asking is very good, Wanja, because we have a public health officer, so that you get to know, does he consume the services? Or even him, when he gets sick, ako Nairobi hospital, Aga Khan, kidogo anakimbia kutoka Kariobangi very fast. Anatoka hospitali akienda hospitali. That is just but an example.
Yeah, maybe if perhaps I would respond to that. You see, in Kariobangi is a level 3 hospital. So there are not some of the services that are not offered there. Yeah, like if maybe I would want to go for dialysis, it's not offered at Kariobangi. I'll have to go either to Kenyatta or to any other referral facility. So it also depends on the services that you wish to get from the facility from where.
But I'm also asking, have you had instances where you as an individual, or rather maybe a colleague, asking for a friend, you know, who works in a hospital setup, but yes, anaumwa na kichwa, a very throbbing headache for months on. But hata enda kupimwa hapo, ataamka atoke aende wapi? In a different hospital to go and seek services there. Have you had such instances?
Yeah, mostly they happen. You see, like as healthcare workers, we are covered. So if I'm covered, if I'm under comprehensive cover, I would wish to go and get the service at a better facility, because there's no way, like, I believe even if it were you yourself, Joy, I believe you will also do the same. Because you can't, wanasema mganga hizi.
Wezi tibiwa na beshte yako kwa hosi. I had a friend who works for these big hospitals,